I don't go around. Some promising news for those of you who suffer from hip and knee pain. There is a new procedure at Hartford Hospital that may help you get back on your feet a lot quicker. We're talking about something called Makoplasty. It's actually a robotic arm that doctors at Hartford Hospital are using for partial knee and total hip replacement surgery. Joining us live to talk more about is Dr. Paul Murray, an orthopedic surgeon at Hartford Hospital. And we thank you for being with us tonight, Dr. Murray.
Great to be here.
Well, first of all, tell us, what is this Makoplasty? How does it work?
Well, Makoplasty basically refers to robotic-assisted partial knee replacement surgery and total hip replacement surgery. And it's a very exciting technology that simply adds great precision to the procedure, and this should in turn lead to better outcomes of a procedure that's already quite successful.
And it's all about the precision, as you well know. What kind of patient would be a good candidate for Makoplasty?
Well, with regards to the knee, it's a patient that's having significant knee pain and has failed all forms of non-operative treatment, and on x-ray has a knee that's arthritic in only one or two of the three compartments of the knee.
What about a hip?
With regards to the hip...
That's where I was going. Go ahead.
With regards to the hip, it's done in people that have end-stage osteoarthritis, have failed conservative treatment, and are simply in need of hip replacement surgery.
Let's talk a little bit more about the advantages of robotic surgery. We've talked about precision. How does that help the patient?
Well, with regards to knee surgery, the precision allows us to put the implant in the best optimal position in the knee. And if this can be done each time, the alignment of the leg will be more anatomic and the outcome should be better. The knee should simply last longer. And the same with the hip. If you put the socket in the exact position that you want to be in with the aid of the robot, you'll have a better positioned cup. This will lead to less dislocation rates, lead to less wear, and increased longevity of the implant.
That sounds very exciting. As you were explaining that, Dr. Murray, we were looking at a very interesting animation showing how precise this instrument is. We thank you so much for bringing us some insight on that. And if you'd like to learn more about Makoplasty, Dr. Murray will be speaking on April 18th from 10 to 11:30 a.m. at the Farmington Marriott. The seminar is free and it's open to the public. Now, if you have any questions for Dr. Murray, you can certainly chat with him live right now. Just go to our Facebook page or our website, WFSB.com.
Channel 3 Early Warning Weather with meteorologist Mark Dixon.
All right, so before we get to the weather, I understand you were out today.
I was at a school today, and I want to take a moment.
Beautiful day to be out.
A big shout out to Ms. Graham's second grade class at Daranowski Elementary School in Southington. Today was guest reader day, and I had a wonderful time. The children were so well behaved. They had great questions and just so eager to learn. It was a great day. So keep up your studies, kids. Everything we talked about, keep at it. Practice.